Here at Oxford Population Health, involving and engaging the public is at the heart of our research. We want to inform and inspire the public about our research, consult and collaborate with them about the design of our research, and listen to their experiences and views. We call this Public and Patient Involvement and Engagement, or PPIE for short. And it can happen throughout the research cycle, from when research is being prioritised and designed to when research findings are being published and shared. But not all members of the public either hear about our research or are aware that they could become involved in shaping it. We wanted to understand how to reach a more diverse group of people, particularly those most underrepresented in research and most at risk of poor health outcomes. We did this by running an online listening series, asking charities, organisations and individuals representing families how we could make our research more accessible. We focused on research we do at the Policy Research Unit in maternal and neonatal health and care, but the lessons we learnt are true for all population health research. Here are some of the people who spoke to us from their homes and offices.
Yeah, hi everyone, I'm Sandra Igwe. It's good to be here. I'm the founder of the Motherhood Group, so it's a social enterprise dedicated to support the Black maternal experience.
So my name is Simone Muller and I'm co-founder of an organisation called Happy Moments here in Batley and Dewsbury.
So I'm Amneet. I run a charity called Willow's Rainbow Box that supports families through pregnancy after loss.
Birth Companions are a charity that support women who are facing multiple disadvantage in pregnancy and beyond, usually up to kind of 2 years postnatal. And we work with women in the community in London and in women's prisons.
Chris Stein from Future Men. We're a London-based charity that works with boys, young men, and men between the ages of 0 and 25.
In the listening series, we presented some of the barriers we know exist to engaging in our research. We wanted to know how to overcome these and any other barriers. From what people told us, we identified 5 themes. First, we had to build trust with organisations who already know and work with the people we'd like to engage.
For many groups, especially Black and ethnic minority groups, there's a lack of trust that's always been there. For many of us who've had traumatic birthing experiences, generally, going through systemic racism throughout, completing a survey that doesn't really seem like it's going to, on the paper, improve their circumstances immediately. They may not want to engage, but if you are linked to grassroots organisations and those who are already on the ground, who are doing the work and that they've already trusted because of that reputation that they've built, then you're more likely to have a better response.
But also to the point that everybody's been making about trust, making use of agencies such as Future Men who have already built that trust to support the delivery of the research.
There's a real need to build that trusting relationship from the start. So I know that through conversations with different ethnic groups of parents, there's a lot of sort of mistrust on where their data is going and what's being done with it, and they don't feel like they've been listened to in some cases in their pregnancy. So why would they be listened to now if they are to fill out this survey? It's kind of a, well, what's the point, because I wasn't listened to from the start.
Consulting and collaborating with organisations and individuals who are experts by experience throughout the research cycle, and not just at the end, will help widen engagement. We were told to involve people in co-producing a survey, not just filling it out, and in this way we would build longer-term relationships for any future research.
If you're consulting from day one, you are absolutely going to get better results, because you're going to get women that say that's not going to work for me, or that's not going to work for some of the women that I'm here representing. So if you're able to do that in any of your projects, so for example, the project that I'm working on just now with Oxford University, like we're right at the very beginning, and she's saying, what do I need? What do we need to put in? And I'm saying, right, this is great. We're on day one. So I know it doesn't always work for things like national surveys, but any other research, when you're looking at it, lived experience needs to be a first thought, not a middle or a last thought.
Vouchers are great, but what I always say to researchers is, it's not just that people just want to come to a meeting just to get a voucher. You know, people understand that there's a long-term growth prospect for them where they can develop, you know, these groups that have just come out from need, and that they can develop those groups, and those groups can expand because they're collaborating with organisations that actually really value and care about what they say. They're going to work with you. And I think there needs to be a lot more of that, and seeing how we can add value to those groups so that they feel invested to then support you on your objectives.
Yeah, well said.
Informing and inspiring the public to engage means that we need to show that research has impact and brings positive change to them, their families and communities.
Yeah, I really like the you said we did, so people, you know, it's that feedback loop, isn't it? If you know that someone's listening to you, you will speak more, you feel that confidence. So the you said we did is really, really powerful in terms of, you know, this was the idea you had, so we did this, and then that's the impact it had, and that empowers that person to say, oh well, actually, and I had this idea too, and it really helps. So like Rachel wrote me into one maternity project, and 5 maternity projects later I'm still here, and it's encouraging other women to do that, to go, well actually, you know, if my first experience had been really bad, if Rachel hadn't treated me well, or if I didn't feel like I was included in the research and my voice hadn't been heard, I wouldn't be here today.
What would motivate Black mothers to take part? You'd have to try really hard, I'm sorry to say. You really would. Whenever data comes out about us, it's never favourable. It doesn't either paint us in a good light or show that our experiences are good. So we're a bit tired of it, to be honest. We are. And unless we can see that something concrete is actually going to come out of this, and not just another load of statistics, then what's the point?
If I was to ask somebody here to fill in a survey that fill in or take part in research or whatever, that might affect government policy, they, you know, it's not enough to say that, and it's not enough for it to be on the Department of Health website that nobody goes on, no general Joe public goes on, I'm afraid. You know, so it's not enough that it needs to be more about them and their communities, and it's about drilling it down to, you know, being at place and doing, you know, and working with people at place. You can't have a one size fits all, one survey, one way of doing it fits all, because it's not going to work at all.
When aiming to involve or engage people, we must use communication that's clear and appropriate for the audiences we're trying to reach. For someone like Sally, for instance.
I'm Sally Darby. I run a network called Mums Like Us, which is a network for disabled mothers. I've got multiple sclerosis and I'm very visually impaired, so I basically can't see any of you, but I'm just assuming that you're all smiling back at me.
And I've literally fallen at the first hurdle, which Sally told me that she was visually impaired right at the beginning, and I put up an image with words on it and expected her to read it. So, I mean, that's classic, isn't it? There you go. I have learned immediately. So, Sally, I apologise. And essentially what the image shows is just all the things that we have heard from people. So researchers don't look like me. I can't relate to them. They don't have the same colour skin. They don't come from the same culture. They don't look like me. We'd have to work harder to reach a more diverse population.
And I was fascinated to see that you have 19 different languages for your survey, but I didn't see anything about different formats. You know, is it Braille? Is it easy read? Is it audiovisual? Is it blah, 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 blah. So our parents need them in all sorts of formats. Easy read is one, but a lot of them struggle with literacy, and anything longer than 2 pages of A4, you've lost them.
Find that one or two of the statistics from an infographic sort of stays with me, and it's something I continue to sort of associate with and can even share with others. So academic journals are great, and but the chances of me with so much literature out there picking up a journal or looking at a journal online and seeing that particular article is quite low.
Producing infographics that kind of demystifies what research is. Infographics about what is in it for you. How can you get involved?
To capture people's interest in getting involved in research, we need to think about where they live and work, what social media platforms they use, and what other pressures they have in their lives.
I think that some disadvantaged communities actually don't see that they have a voice. They're sort of overburdened by the difficulties in their lives. And so the bits that we've already said about reaching out, Smear's points about going to those places that those families hopefully will frequent are the ways of engaging. Because we can't assume that those parents will have the motivation and the space to think, oh, if I got involved in research, things would change.
Being disabled is isolating, being a mother is isolating, being poor is isolating, living in poverty is isolating. When all of those things are going on at the same time for so many people, and so I think if we can find a way of reaching those people, and I think, community groups, but then it's communication within those community groups to try and find out about people who aren't attending those community groups or who aren't either able to access them or who are choosing not to access them, and somehow reaching out to those people so that the people who are the most hidden and sometimes their voices are not easy to hear. It's not nice to hear what people are experiencing, but I think that we need to get to those people.
Parents that have had their children at 14, maybe not have finished school, etc. So actually having a survey with like 20 questions is like far too many questions anyway to just send to the house and assume that they're going to feel like this is important to them. So I think it's also thinking about what stage some of these parents are at as well. If they're at a stage where they're still at school or a stage where they're still at college or just trying to find a job, that's important to them.
The 5 themes we identified in the listening series that would increase the diversity of people who might engage and get involved in our research were: build trust, involve us from the beginning, show us impact, use communication that is clear and appropriate for each audience, and imagine life in our shoes. We've written much more about these themes and what they mean practically for you in written guidance that's available on the web platform NDPH TV. We hope you find it helpful.
Yes, so my name is Nanajua Butcher and I'm here today representing Black Mums Up Front.
Morning everyone, I'm Harriet. I work independently as a young parent consultant, organisations that typically relate to young parents.
Hi, my name's Sabina. I'm the Chief Executive of the Muslim Bereavement Support Service, and it came out of an organisation which you may instead have heard of called the Gardens of Peace Muslim Cemetery. Now, the Gardens of Peace Muslim Cemetery is now the biggest Muslim cemetery in Europe.
Hi everyone, and I'm Jackie. My name's Jackie. I'm the Chief Executive at Shoreditch Trust.
Hi, I'm Lisa Acaster, so I manage the Anti-PAM service, which is a service for pregnant mums and their families in Kirklees. So we have bases in Dewsbury and in Huddersfield. I'm in Huddersfield at the minute.
That's what I love about things like this. You meet all sorts of people that you've never met before. It's fantastic. Okay, so I'm CEO of an organisation called Parents First UK. We're a charity. We specialise entirely in perinatal peer support.
Yeah, my name's Mark Williams. founder of International Fathers Mental Health.
Hi, Adrian. I'm from Bristol. I work for a charity called Dads in Mind.
Yep, I'm Scott. Not part of any organisation. I've been on a co-development panel for NHS Digital Trials.
Kathy Jones, I'm Joint Chief Executive of Fatherhood Institute. We're obviously interested in every aspect of fatherhood.
Thank you for listening.